Now, I spoke to you about gluten-related disease, candida-related complex, and malabsorption, and how that interplays with our tight junction structures in both the gut and the brain. And we're going to develop some further concepts about that, but in particular today, we're going to talk about how to clean out the riffraff. So when we talk about cleaning out abnormal organisms in the biofilm, we're really adding to our ability to remove inflammation and protect the tight junctions in the intestinal lining. Because as you may recall, that as we protect those tight junctions, we are also protecting the tight junctions in the blood-brain barrier. So healthy tight junctions are key to protecting our gut and our brain. So gluten-related disease, dysbiosis, and other tight junction disruptors are important to identify as we want to work with the psychological and cognitive function of our patients. And remember, we're in a sea change regarding our understanding of the gut, and we're moving away from the notion of pathogenics and moving into more the ecology, an ecological approach to restoring gut balance. So back to our ecological approach to the biofilm. Today we're going to specifically talk about the remove part of it, but remember this is part of the complete sense of restoring digestive fire, if you will, making sure that there's adequate digestion, and then following up with re-inoculation with prebiotics and probiotics, and looking for, particularly in patients who've got significant inflammation, giving elements of repair. And then rebalancing has to do with, of course, the gut lining does not exist in isolation. So all the things that are good for the body in general, including sleep and proper diet, an inner life, an outer life, and exercise, are all important for digestive health as well. For pharmaceutical antibiotics, if the infection seems to be pronounced or the consequences seem to be high vis-a-vis autoimmune disease, you certainly may use a pharmaceutical antibiotic. I would, however, not use a quinolone. I basically stopped using quinolones because of long-standing side effects involving nerves and tendons. And so it is pretty rare for me to use a quinolone. My two common go-to antibiotics would be doxycycline, which doesn't show up as a specific on the sensitivity panels, but tetracycline does. So in its stead, you could use doxycycline if it's indeed sensitive to it. And then sulfa. So sulfamethoxazole, trimethoprim sulfate can be used as well. These are not broad-spectrum antibiotics, and they're reasonably inexpensive. So don't wait for a positive stool test because you'll wait a long time. So worms remain very difficult to find under the microscope, and until we have PCR testing or something comparable, we're going to be thinking about treating presumptively. So this is common in tropical countries where deworming is not unusually done every year or with the onset of a diarrheal disease. The treatment, if you're going to do presumptive treatment for worms, consider it for people who've had either extensive third world travel or frequent third world travel, or while traveling in a third world country.